Hi guys, my name is Deja, and today I'm going to teach you how to assess the integumentary system. The integumentary system includes your hair, skin, and nails. First off, I'm going to start off asking my patient about her medical history. Things like what kind of soaps she used, what kind of lotions, oils, shampoos, conditioners, anything of that nature. I'm also going to ask her any questions about has she seen any rashes appear, bruises, anything out of the ordinary. Does her skin color change when the weather changes, things like that. After asking for her medical history, I'm then going to move on to inspect her hair. So I would have her remove her headband and let down her hair.
Do you want to see my hair?
Usually the football players oh, nervous, we gotta kick their ass or something like that.
Okay.
Should I zoom in?
Alright, so I'm basically going to bend her head down, and look close into the light. And what I'm looking for are things like bugs, so meaning lice or ticks. I'm looking for even hair distribution. I'm looking for no hair loss, no bald spots. Make sure she has a clean scalp, no dandruff, which are like flakes, white flakes that come from the scalp. I'm looking for any scalp lesions, any scabs of any sort. So I'm basically rubbing my fingers through her hair. I want to make sure it's not thin in any place, it's thick all over. I'm looking for wingworms, which can be like circular things on the scalp. I'm not looking for any of that stuff. So right now, her hair looks really great. There's no bugs or anything to be out of the ordinary. We're just looking for a nice clean scalp. So then we're going to move on to the skin. For now, we're just going to look at her arms. As I'm looking at her arms, I'm looking for color. So I want to make sure her skin color matches her skin color. I don't want to see any jaundice, any redness, any keratin overload. Like all that is out of the ordinary. We don't want any of that. I'm going to talk about temperature as well. I'm basically going to feel her with the back of my hand to make sure she's not too warm or too cool. We want the temperature to be at 98.6. If you're too far below that, then it's called hypothermia. If you're too far above, which is hyperthermia, which we don't want. We're looking for 98.6 or 99. Nothing too far above that. We also want to check for hydration. A good way to check for hydration is by taking your index finger and your thumb and lightly pinching the skin, and it should go right back to its original position. I'll do it again. If it doesn't do this, it's a sign that the person is hydrated. So you might see in elderly people, it might form a weird tent at first and then slowly move back to its original position. That just means they need some hydration in their life. I'm also inspecting the skin for rashes. Rashes are like any itchy red area. Some people don't even know they may have a rash. They might just be itching at it and don't even know what it is. So if I do see one, which would be out of the ordinary, I would ask questions like, does it itch? How long has it been there? How did it get there? Did it just like randomly pop up, or did it spread through your arm or leg throughout the days or whatever? So I would ask that. And I would move on to bruising. Bruising could be a sign of a blood clot. It can be a reddish, blackish, bluish area, so we don't want any of that. And if we do see that, then we ask questions like, how did it get there? How long has it been there? Things like that. From then we could do coagulation blood tests to see if they do have a blood clotting disorder. We're also looking for things like moles. People have moles. Moles aren't out of the ordinary. It's what the mole looks like. We're looking for moles, just a regular circle mole. If it's like jagged edges or discoloration, so one half of it is darker, one half is lighter. If the mole has grown, if at one point in time you saw the mole was smaller and now it's larger, or if the shape formed a weird shape, we want to check into that because that can be a sign of melanoma, which is not good at all. We would use a dermoscopy, which is a magnifying glass that we can put over the skin. It magnifies the mole 10%, which is a lot, so we can just see what the mole really looks like. Then odor. You want to notice any odor coming from the patient, like if they smell of like alcohol, or if they just smell like they have bad hygiene. You want to address that situation and make sure that their bathing routines are appropriate. Scars. If we see scars, we're looking for any scars. Okay, so see a scar. We're looking for how she got that. So I would ask her how she got that, how long has it been there, does it still bother her, what did the doctor do last time, did they stitch it up or did it just heal itself? We're asking questions like that. To the nails. As far as the nails, we just want to make sure that her nail bed is not irritated. We're asking things like, do you wear acrylic nails? Because acrylic nails can be a source of fungus, and that's not good. We're looking for discoloration or trauma to the nail. Did you drop something on your nail and now it's like a blackish color? Do your nails grow to a certain length and then automatically break off? So we really want to pay attention to the nail. Okay, so the nail was our conclusion of the integumentary system assessment. So that is a head to toe assessment of the skin.